Hello, everyone. I'm Teresa Jorgensen. I'm the Clinical Research Manager from the ASU's College of Health Solutions. It is an honor to have you guys here as you earn such an important badge. So we're going to do a visit of our Translational Research Center. You're going to get to see some examples of the technology we use, meet some of the researchers, and then go over some of the procedures that we utilize here in the center. This is a very innovative model in that it's a shared use facility that not only the College of Health Solutions, but all of ASU researchers can come and utilize the space. So our researchers get the opportunity to collaborate with industry partners, different types of scientists who are coming out with different technology. So we're going to go inside, and the first thing we're going to do is test out how many fruits and vegetables some of you guys eat, and then compare it to your troop leader to see if they also are eating the right fruits and vegetables.
This is the Veggie Meter. This measures the carotenoids. The more fruits and vegetables you eat, the higher levels of carotenoids will be in your skin.
Yeah, so it's utilized a lot in schools for nutrition-based interventions, again, for tracking that. Okay, so who's up? Who eats a lot of fruits and vegetables?
Stick your finger right in there, your index finger right on there. Be a little tight. Too much candy. You can kind of see the curve with where you fall in the general population.
Today we will talk about health effects of pollution.
One of the projects that we're working on is systems biology of asphalt. For everyone that's been outside in the summer, what is something that you notice whenever you're on an asphalt road? Smells a bit more. That's the answer I was looking for.
But yeah, so what do you think it means that something is smelling? When you smell something, you breathe it in, and your sensory system is able to detect that there's something in the air, even though can you see it? You can't see it. That's the problem, right? So sometimes we can smell it, but many times we can't even smell it.
One of my big areas of research is the detrimental effects of sitting. And you may think, sitting? Why is that bad for you? Even if an individual gets the daily recommended amount of physical activity or exercise, but they sit for long periods of time during the day, that effect of the sitting is still there, and it is not neutralized by the exercise that they do.
So what do you guys think is going to happen to the blood pressure when we go from lying to sitting to standing? Yeah, so now we're gonna sit, and we're gonna acclimate for about a minute or two. So now let's go ahead and stand up. So we went up, down, up. Like in science, nothing is completely like we think it's going to happen.
So the last part of our demonstration is going to tie into what Dr. Sears and Dr. Wilson were just talking about. Most of our focus here is cardiac and vascular. When we look at the heart and we utilize ultrasound, even to an untrained eye, if I stick my finger right in the middle of that black chamber, you can see the myocardium, the muscles squeezing and going towards the center. Now this technology actually looks at the fibers and the rotational mechanism of the heart itself, and that allows us to identify abnormalities months and months and months before ever seeing that on the other older technology like EKG and the plain 2D. And as they said downstairs, I brought in some of the technology because you can see the different career paths that you can take and still be involved in public health. Thank you guys so much. This is the end of the tour. And thank you, Anthony, for volunteering.